Hi, I'm Mark Tremblay, the Director of the Healthy Active Living and Obesity Research Group here at the Children's Hospital of Eastern Ontario Research Institute. I'm also a Professor of Pediatrics at the University of Ottawa and Chief Scientific Officer of Active Healthy Kids Canada. I would like to invite you to participate in the first of a series of 3 fireside chats on childhood obesity prevention, being organized by the Chronic Disease Prevention Alliance of Canada in partnership with the Public Health Agency of Canada, Canadian Best Practices Initiative, and CHNET-Works, part of the FERN initiative at the University of Ottawa. These fireside chats, in the form of a series of webinars, will provide an opportunity for experts to disclose best practices in the prevention of childhood obesity, and also allow for networking through discussion and dialogue amongst practitioners, researchers, and decision makers. The initial fireside chat in this series of webinars will discuss and provide an overview of the childhood obesity situation in Canada. Several topics will be discussed, including an introduction of the issues, childhood obesity trends, magnitude of the problem, implications for chronic disease interventions, community and policy level interventions, individual and family level interventions, and sources of best practices information and how to find out that information will be provided. We are thrilled that you're joining us for this first of 3 fireside chats on the prevention of childhood obesity. It's unfortunate at a certain level that we're needing to discuss this on a national level, this issue of childhood obesity, but the reality is that about 1/3 of Canadian children and youth are overweight or obese using the World Health Organization standards. The Active Healthy Kids Canada report card on the physical activity of Canadian children and youth consistently gives the country a failing grade. We've got to do better. We need to do better. And to do better is going to take the implementation and sustained implementation of best practices at a policy level, at a regulation level, at a community level, neighborhood level, household level, school level, and individual level. And this webinar is going to talk about some of the best practices, and the series of webinars will talk about best practices at these various levels. What can we do as public health professionals, as researchers, as decision makers to try and overcome this public health challenge that we currently face? It's clear that our lifestyles have changed dramatically across the last couple generations. When we compare to Amish kids, contemporary living kids take far fewer steps than they did in the past. The screen time of Canadian children and youth is approaching 8 to 9 hours per day outside of schoolwork. We've got to change this. Our eating environments have got to be transformed to ones that are more conducive with healthy eating. So we welcome you to this webinar, and we encourage you to participate, to dialogue, to share success stories, and to learn from what the webinar has to offer. Thank you.